Story 1. I have to give pretty bad news on a frequent basis. Most people know it's coming. My last week in residency, I had to tell a mother that her daughter was going to die. She came in talking the night before and had surgery for a life-threatening problem, but we thought she would make it after. Halfway through the day, her vitals and labs took a nosedive, and it was obvious that our efforts had only stabilized her temporarily, but we lost. She was intubated and peaceful, but she was young and had 2 small kids. We have all seen the TV drama-style screams, pounding on the table, begging for someone to do something, sobbing. When it's real, it's so much harder. Her mom was crying on the floor asking me to take her organs to save her daughter. I'm not emotional, but that day wrecked me. I went to the bar after with my supervising doctor, and we didn't talk. I try not to think about it. Story 2. Delivered news to an older patient that her liver cancer was not operable and not eligible for locoregional radiation or even palliative chemotherapy because of how far gone her liver function was. There were simply no more options. Her husband was with her in the room when our team delivered the news. As soon as we said our part, the 2 of them just held hands, rested their heads on each other's, and they started crying. At that moment, I didn't even see them anymore. I saw myself and my wife. I barely held it together in that room. I still don't know how I made it the rest of the day without breaking down. As soon as I got home, my wife wasn't home yet, but I badly wanted to see her. I just sat and cried for a while after that. Story 3. I worked in an internal medicine office and had to tell a patient that his human immunodeficiency virus test came back positive. I asked the medical assistant to come get me as soon as he was checked in for his appointment so he would not have to wait very long for me in the exam room. I opened the door, and he smiled and said, "I think I know what you're going to tell me." I nodded my head yes, and he put his arms out to be hugged. He cried and we hugged. That was in 2016. I've retired from the clinic since then. He connected with me on social media. His viral load is undetectable, and he has a new job that he loves. Story 4. Telling a very young patient that their cancer, which was assumed to be curable through surgery, was in fact not so because it had spread to the brain. It was a rare cancer that rarely spreads and rarely affects younger people. Some people get all the terrible luck in the world. The patient was remarkably stoic, but one of the parents lost it. The tears, wailing, pleading, and breakdown aren't anything I'll forget. The rage against the system, the accusations I must be wrong, and then the pleading and tears again. I think it's the fact I took their hope away from them. There is no happy ending to this story, but I'm the one who had to tell them. Years later, I can still see their face and grief. It's burnt into my memory, and it took a while to accept that perhaps trying so hard to forget would disrespect the patient's memory. I'm trained to deliver bad news and do it regularly. This one remains one of the only times where a case utterly emotionally broke me, and my supervisor saw my reaction, sent me home, and told the department I'd be off for a few days. There are always those cases that stick with you forever. Such is life. Story 5. First year of being a doctor, a patient had an abrupt, very unexpected code and died shortly after we had just discussed starting a new round of chemotherapy the next day. Fully laughing and just hanging out with his family in the room not 30 minutes before he passed. It was the kind of experience that shakes you, makes you consider leaving medicine because you do not know if you will ever trust yourself again. I lost it and spent 15 minutes crying in a stairwell before I could bring myself to go to the family waiting room and tell them. But when I got there, they said they figured out what had happened. They were sad, but thanked me for at least making his last day a happy one and hugged me. I slept on the floor that night out of exhaustion. Their reaction is the only reason I was able to peel myself up in the morning and get back to work. It has been years, but I will never ever forget it or him. Story 6. Emergency room doctor. I just had a young lady die of a drug overdose. She was only 22. Her brother came as we were coding her, performing chest compressions. We had done everything, and there was no bringing her back. I asked if he wanted to be in the room when we stopped, and he said yes. His reaction was heartbreaking. He screamed and cried and then picked up her body and whispered in her ear, "I love you so much. You are my best friend." He just held her and kept saying, "I love you." All the staff had to take a moment after that. I have done this for 8 years, and that was one of the saddest, most heartbreaking things I have ever seen. I will never forget them. Story 7. When I was a resident and training in the pediatric intensive care unit, I had a family whose 3 sons were in a horrible car crash. One thankfully walked away with only a broken arm, while the other 2 were unfortunately admitted for severe injuries, and I was assigned to be their primary medical provider. It became clear after a few days one was going to make it through, but the other was not and was officially brain dead. I remember sitting down with the family to talk about next steps as they wanted to withdraw care, when the mother suddenly stopped me, hugged me, and said, "It's okay. We want to donate his organs before we withdraw care." The day he was born, I just knew I had to name him Valentino so he'd have a big heart, and now he can give that heart away to someone who needs it. I've never cried as hard as I did when they wheeled him to the operating room for organ procurement, and I still tear up to this day. Story 8. I worked as a pediatric psychology fellow while in graduate school for a Doctor of Philosophy in clinical psychology. This involved providing psychological services for all children in the hospital. One of my very first weeks, I was shadowing a more experienced fellow, and we encountered a family whose child, a 7-year-old girl, was hospitalized after she was in a car accident with her father. Her father died in the accident, and no one in her family was comfortable directly explaining this to the child. They had used a lot of religious euphemisms about death, such as "he's watching over you in heaven" and "he's with you in spirit." But this language is not concrete enough for a young child who does not really understand death. Sitting with this child, who was in a body brace with lacerations all over and a very flat effect, and explaining to her what death was, that her father had died, and having to ask questions to make sure she understood, was one of the most traumatizing experiences of my graduate training. I can still vividly imagine her face while we were telling her, and the tears silently rolling down her face. Story 9. Trauma surgeon here. I looked after a young female nurse I worked with for years, after the car she was in with her fiancé was struck by a drunk driver. She had unstable spinal fractures, was flat on her back in a collar, and needed semi-urgent neurosurgery. I had to tell her that her fiancé was brain dead, taken from the scene by helicopter to the other trauma hospital in our city, and was on a ventilator in the intensive care unit. She was taken longer to extricate from the wreck and had been brought to us. His parents refused to make a decision about organ donation or withdrawal of care without her consent, but he was deteriorating fast. We moved mountains to get her urgently transferred in full spinal protection across the city to his hospital, and put in the bed next to him so she could hold his hand and say goodbye. Then she went off for neurosurgery. It broke my heart. Her sobbing and gasping for air while not being able to move. Tears running sideways down her face, and her mom trying to keep her still to protect her spinal cord. But I will hold a place in my heart for everyone I called that day to say we need to move this girl. It was a bank holiday and every bed was full. Entirely medically unnecessary, but absolutely the right thing to do. Story 10. Not a doctor but worked as a medical scribe. Basically, went into rooms with the provider and listened to the story. A guy was diagnosed with very severe cancer via an outpatient positron emission tomography scan and was told by their poor oncologist to come to the emergency room, so someone else had to break the news, allowing the oncologist to stay home. Anyway, I watched this otherwise cool provider take a 15-minute break afterward to go cry because the gentleman said something along the lines of, "I am so thankful you were here today to help me. And I am so sorry that you had to be the one to tell me this today." Story 11. Patient came in, a 16-year-old girl, and had a rare type of childhood cancer that affects the thyroid. She managed to beat it at the time with no residual symptoms up until she came to me at 16 years old. I am a physical therapist, for her weekly exercises. She was not my patient, and I was just filling in as a floater for the day. She mentioned how recently she had been feeling a deep, achy bone pain at night. At the same time, while assessing her, I noticed some newly found painless lumps or nodules. Somehow, this was not caught by her previous provider. After I explained what was going on, you could instantly see the realization that happened in her head. We looked at each other silently and did not say anything, just an intense emotional silence in the air. You could see the tears really welling up. She thanked me and I sent her to her oncologist. She had stage 4 thyroid cancer, and she knew she did not have much time left. I was 26 years old at the time and very scared, being so new in the field. It is weird, all of a sudden, I knew exactly what to do, and I still think about her to this day. That memory is forever engraved in my head. Edit. Wow. I woke up and did not expect this many likes. Working overtime the last 2 days, so it will take me a minute to reply, but I will address the questions. Story 12. Just because this thread is a bummer, I'm gonna tell a flip-flop story. I was with my mom when her cancer doctor got to tell her that her aggressive metastatic cancer with a low survival rate was responding incredibly well to treatment and she was on the road to remission. Obviously, the reaction from her and me was huge. He quickly excused himself, but I could see he had tears of joy in his eyes. He had been her cancer doctor for almost 20 years at that point, literally watched me grow up. Amazing man, obviously cared deeply for his patients. Story 13. When on a palliative care service in residency, a patient who knew her cancer had come back was hospitalized due to complications. The palliative care team was consulted to discuss goals of care. The attending doctor I was with was the first doctor to sit down with her and explain that she was on her 4th line of chemotherapy agents. Even in the best case as a first line, the medication she was on had a 30% chance of extending her survival. Hearing that allowed her to give herself permission to not go through the misery of chemotherapy and instead focus on time with her family. It was a very emotional visit, but she kept thanking the palliative care doctor for telling her outright what to expect. Story 14. A patient of mine I had not seen in forever came to the emergency room because he could not manage at home, too weak, losing weight. He was a blue-collar worker, coping heavily with alcohol and smoking. I took one look at the 50-pound weight loss and knew. "Doctor, I think I'm on the way out," he said. "Not going to lie to you, I'm worried about that too," I said. He had massive lung cancer that had spread to the bones and liver. He died 2 weeks later. Story 15. I'm a pediatric oncologist, so I've seen the full range of reactions, and all of them have stuck with me. But here's a story about the reaction I never saw. When I was a first-year pediatric oncology fellow, you did 2 months of what was called the oncology consultation service. This meant that you were the fellow on call to evaluate all patients with a potential diagnosis of cancer who came into the hospital. For example, a child with low blood counts and bruises seen in the emergency room, or a patient on the orthopedic service who had an unexplained fracture and a lesion on X-ray that was suspicious for cancer. Once you helped make the diagnosis of cancer, you would either admit the patient to the hospital, where the fellow running the inpatient oncology service would take over, or you'd have them come into the oncology clinic where they'd be assigned to a different oncologist. You were typically the first point of contact, but in many instances, you didn't end up becoming the patient's primary oncologist. You just moved on. One night, I was called to the emergency room to evaluate a child with symptoms consistent with leukemia. No matter how much families are prepared or think they are prepared, the reaction that you get when you knock on the door and go into the room and introduce yourself by saying, "Hi, I'm Dr. Blackman, I'm from the Pediatric Oncology Service," is pretty much the same. You are clearly the person they dread seeing the most. This night, it was a 4-year-old little girl. I came in, introduced myself, explained why I had been called, and told them that until we looked at the blood under the microscope and did additional tests, such as a bone marrow biopsy, we couldn't know for sure, but that the emergency room doctors wanted me to come and consult. That didn't make the parents feel any better, but that was my job. I examined the child and then headed up to the lab to look at the blood smear myself. Sometimes with leukemia, you need more sophisticated tests: flow cytometry, immunohistochemistry, chromosomal karyotyping, evaluation of the bone marrow specimen. But sometimes you look and you can just see the leukemic blasts, and you can even sometimes tell what the disease is: acute myeloid leukemia versus acute lymphoblastic leukemia. In this case, I looked in the microscope and it was very certain that this was going to be acute lymphoblastic leukemia. There were lymphoblasts all over the place, and combined with the symptoms, I was 99% sure. You're not 100% sure until you have done the bone marrow and flow cytometry. This child needed to be admitted with the provisional diagnosis of new-onset acute lymphoblastic leukemia. I called the inpatient fellow and arranged for the admissions, and then I had to go back and tell the family what was going on. When you tell parents that their child has cancer, You learn very quickly that as soon as those words come out of your mouth, the tests appear to show that your daughter has leukemia. Parents often hear nothing else after that. Just white noise, panic, fear. So you learn very quickly how to get the key points across. The blood tests appear to show that your child has leukemia. Leukemia is a type of cancer. We are admitting your child to the hospital, and we will take extraordinarily good care of her. We know how to treat this disease. We will make a plan, and we will work to make her better. You have a million questions now, and we will answer them, just not now, because right now we need to focus on securing the diagnosis and taking care of your child, but we will take extraordinarily good care of your child. We've got this. We know how to treat this. You have to use the word cancer, unfortunately. You need to be unambiguous. And then you need to tell them that we've got this. We will take care of their child, and we will make them better. Anyhow, after that, the big machine kicked in. I wrote my note in the emergency room, wrote some admitting orders, and then the patient was transported up to the inpatient unit. Oftentimes, I'd never see the patient again. This was a very large tertiary care referral center. A couple of years later, I was in the elevator. I was now a third-year fellow, spending most of my time in the lab, occasionally taking calls or checking in on a patient of mine who was back in the hospital. That evening, I was standing there, looking through some papers, when I could sense someone staring at me. I looked up and there was a woman looking at me, so I said hello, and then asked if we knew each other because she looked a little familiar. And then she said that I was the doctor who saw her child in the emergency room 2 years ago when she was diagnosed with leukemia. I asked after her daughter, she was doing well, then apologized for not remembering her, and told her that I was surprised that she remembered me after 2 years and having only talked with them for maybe an hour at the time. And what she told me next has stuck with me for nearly 20 years. She said, "There's no way that I could ever forget meeting you. Seared into my memory. I remember every word that you said to me that night. It really shook me, and I told her that I hoped that I had done right by her daughter." She said I did. But it made me realize that, as a doctor, and in particular in my role, patients and parents sometimes hang on every word that comes out of our mouths. That we wield enormous power regarding our ability to instill hope or trigger fear or cause despair. While we may see thousands or tens of thousands of patients pass before us in our careers, patients may only encounter a few doctors, and for pediatric oncologists, sometimes very few. We make an outsized impression even with the smallest words or phrases. It also made me realize, this was before I was a parent, the depth of the fears that parents have when it comes to their children's lives, and how your being there when a parent senses that their child's life is in danger irreversibly imprints your presence on their memories and their lives. It is an awesome responsibility, and one that I feel privileged for having been given. I hope that whenever I've had to break awful news to patients and families, I've done right by them.